Okay, the member for Braddon has the call.
Thank you, Mr Speaker. My question is to the Minister for Health. Why is it so important that the Albanese Labor government invest in bulk billing after a decade of cuts and neglect?
The call to the Minister for Health, Ageing and the Minister for the Disability and the National Disability Insurance Scheme.
Yeah, thank you, Speaker. A big reason why the member for Braddon got the biggest swing of any member in this House was her relentless support for a stronger Medicare and cheaper medicines, Mr Speaker. And for her and for Labor, bulk billing is the beating heart of Medicare, Mr Speaker. The idea that all you need in this country to get great health care should be this little green and gold card, Mr Speaker, is central to our philosophy. And it was hard-fought, Mr Speaker. John Howard, the leader of the modern Liberal Party, said that bulk billing was an absolute rort. The AMA wanted to go on strike over bulk billing, Mr Speaker. But 30 years on, I think most of us thought the bulk billing was here to stay. 30 years on, back in 2014, we didn't reckon on the Abbott government, of course, a government that tried to abolish bulk billing altogether in their first budget, Mr Speaker. And when we blocked that GP tax in the other place, Mr Speaker, the then Health Minister, Peter Dutton, tried another way instead and introduced a years-long freeze to the Medicare rebate, thinking that obviously if you freeze the income of doctors, that will pressure them to move away from bulk billing. Now, Peter Dutton didn't last long as Health Minister, Mr Speaker, but any sense that his replacement might have changed course was pretty quickly disappointed, Mr Speaker. And I think we remember who that replacement was. That's right. Leader of the Opposition, of course. The Leader of the Opposition. Now, as the new Health Minister, she could have changed direction, but instead, Mr Speaker, she doubled down. In her budget in 2016 as Health Minister, she didn't just lock in Peter Dutton's Medicare rebate freeze, she extended it for all of the rest of the decade, Mr Speaker. All of the rest of the decade, marking herself out as the only Health Minister in the history of Medicare never once to increase the Medicare rebate. Even Peter Dutton managed it once, not once under this Health Minister, marking herself out as the person probably most responsible for the situation we inherited when we came to government. A situation with bulk billing in freefall, Mr Speaker. Not the word I use, the word used by the College of GPs, Mr Speaker. Now, for those opposite who for decades fought against universal health care, who hate that little green and gold card, for those opposite, that's exactly what they always wanted, the idea of user-pays health care. For Labor, it was completely unacceptable. And that is why in the last 3 years we've delivered the 3 biggest increases to the Medicare rebate since Paul Keating was Prime Minister. That's why we tripled the bulk billing incentive for pensioners, concession card holders and children, Mr Speaker, and that's why on Saturday we will roll out the biggest investment in Medicare's history to fix the mess that the Leader of the Opposition created when she was the Health Minister.